Hi, folks. I'd like to introduce you to Lee White, who's our Director of Staff Development. Her office is across from the suite where a lot of the social workers are downstairs in the basement, and you always go by her office as you're checking in. When I did a tour for them, kind of coming right in the front door or the back door and that kind of thing. So I want to give Lee a chance to talk about what she's doing, and she's also going to be the person, if you have any issues around the COVID-19 testing prior to you get here, she's the person to talk to, but I'll let her tell you a little bit about what she does and the hats that she wears.
All right. Hi, guys. Very excited. I'm hoping this opportunity is as good for you as it is usually for us. We love Michelle's CPE interns. They just become part of our team. So working really hard on this plan to get you guys to be able to come on board. So welcome. Again, my name's Lee White, Director of Staff Development. I also do all the infection control for the organization and occupational health. So if you do have a work-related injury or anything like that, you would come and see me as well. I have filled in as the interim director of nursing. I'm kind of just settling back into this role right now and adjusting and building and creating, and very hopeful to do some major educational opportunities. I got a lot of thoughts and a lot of plans in my wheelhouse. It's just able to roll them out. If you guys do have any questions regarding anything, COVID-19 related, work related, any kind of support that you guys need while you're here, I most likely usually do your just in time, or at least will do your initial new hire training as well, which I enjoy doing because it really gets me to know you guys. Have worked really closely with a couple of the CPE interns in the past to put on kind of some presentations. You guys bring a lot of flavor to the table and diverse backgrounds, and love to kind of use any past experiences that you guys may have had to help support and educate if it's pertaining to our kind of environment here. What else can I tell you? There's a lot going on here. It's a really busy community. It's a really busy organization, but it's a really great organization. Hopefully you'll feel welcomed and embraced, and let's make this a really, really great, solid opportunity for you.
I've asked everybody who I've been interviewing how COVID-19 has changed. You probably had the most impact of anybody. We had limits and you just had more work, and I didn't know if you had anything to say about that.
COVID-19 is changing every day. So one of the hardest parts about this has been, how do we fight a virus that we can't see? And that's essentially what we're doing, is fighting a virus that we can't necessarily see, because we have those asymptomatic people who walk around and you wouldn't know that they're sick. So it has honestly consumed me every day since March 13th, and a little bit before then, because we closed the doors here March 13th. Every day I'm triaging, I'm keeping employees and residents quarantine, or I'm getting them tested. The practices we've put in place, there's going to seem like a ton of things, like there's specific ways you should walk to and from your units when you get here, but all of those are for contact tracing. And knock on wood, I don't like to say this, but so far we've been doing okay. And I'd like to keep it that way. I really do work hard on what can we do safest to keep our business up and running, because that's important. What can we do to keep the education going, because that's important. All of these things that you never thought you would have to think so much about. Now all of a sudden you're thinking about, how do our staff get their utensils in the dining room? And our organization did a great job. Any recommendation I made initially, the CEO and all the directors have been so supportive and have not given me one issue, because when this change happened, a lot of things changed just like that, and it seemed to happen overnight. So and it just means that the team that we do have here is solid, and every day, like I said, we never know what's going to come out. But the guidance changes so much.
Yeah. Wonderful. Well, any last word of advice or
No, I'm excited to meet you guys, and I hope you find this fulfilling. And I know you're going to learn a lot. You have a great educator, and she's very passionate about what she does. So good luck. I'm always here if you need me.
Hi everyone, this is Trish Blackburn. She's the Director of Home Health Nursing. Her office is over here on the Havenwood campus, and I'll let her tell you a little bit about her department and their role in the lives of our residents.
Hi everyone. So our home health department is here to support the independent living community. Excuse me if I'm nervous. I don't like to be videotaped. But we are here if the residents need us in an emergency or just day-to-day activities. They may drop in, they may push their pendant or pull their pull cord, but we're here 7 days a week, 7 in the morning till 7 at night. It's kind of a drop-in office, so they may just drop in to talk, they may ask for blood pressure checks, a nurse visit. We have residents that live in the lodge here that I believe you've been videotaped on, but that may receive daily assistance. They come to our office for medications, but we may utilize you for assistance if we see that somebody is struggling emotionally. They may have some sort of trauma or maybe a death of a friend. For example, somebody just had a death of a close friend and we utilized Michelle for that. So we may seek you out, or if you are out and about and you are assigned to somebody in the independent community, if you are seeing that they're struggling emotionally, physically, you can also reach out to our department, and then we will work as a team to see what is actually going on with them. I have a staff of nurses and LNAs that we work closely with. We work as a team. And then if something is needed, we work interdisciplinary with a lot of different disciplines. So care management, pastoral, PT, OT, and just even dietary. So if somebody in the independent community needs something. My office oversees both campuses, so we go back and forth between both campuses. So we may respond to emergencies over at Heritage Heights. Right now, we're based on this campus, but we're going to start opening up office visits again over at Heritage Heights. We do a lot of different things. We offer lab services, we offer toenail cutting, we offer showers, LNA services. So there's a lot of different things that we offer, but if you need anything from us, just please reach out. You can reach out to myself or the other nurse that's working with me. I look forward to meeting all of you, and we're open to anything that you need. Thanks.
So Trish, would you tell me a little bit about, and just let the interns know, how has it changed with COVID? How has your kind of role and what's the impact been?
What I've noticed, so we've really kind of backed off on a lot of our home visits. So we do a lot of telephone triaging and asking the residents to reach out to their PCPs. We do a lot of wellness calls to the residents. There's been a lot of self-quarantining, and we've seen a lot of residents really withdrawing and struggling, I guess, with the COVID. We've done a lot more of the emotional support as a team, and really pushing the residents to get out more. I think that's more of what we've seen. A lot of screening, and just I think a lot of deconditioning with the residents. That's a huge impact that we've seen. The residents feel like they feel like they're in more of a jail, and have lost a lot of their independence. So we're kind of on the other end of, they understand the impact and the need to be safe, but we're trying to now push them to get outside, sit outside. A lot of the restrictions are being lifted. So for example, somebody on self-quarantine, the state has said, yes, they can go outside a little bit. They just have to really maintain, they can't talk to other residents, they can't visit with other residents, but they can go out for a short walk around their area, they can sit outside on their decks. So that has really lifted the spirits of somebody on self-quarantine for 14 days. So somebody in the lodge who lives in a one room that has to self-quarantine for 14 days, that is just really depressing for them. So for them to be able to just go outside their door a little bit and get some fresh air, that's huge. But a lot of mental fatigue, a lot of depression, and just their physical decline has been huge in the last 5 months, 6 months.
Yeah.
And it's very sad that, you know, the married couples haven't been able to see each other. That's a huge
When they're living at different levels.
different
of
levels.
care.
Yep.
Yeah.
So somebody who lives in the lodge can't see their face. I mean, they can see behind the plexiglass, but they have not touched for 6 months
Yeah.
after being married for 60, 70 years.
Yeah.
So, but we do a lot more. We don't have as many like the drop-in visits because somebody in a cottage can't come into the lodge without being screened. Heritage Heights can't come in. We can't do as many, so we have to do home visits, but they're very limited right now.
Yeah.
We're starting to open those up a little bit more, but the cottage residents are the ones going to the stores, they're going to restaurants, they're out there, so that really puts us at risk to bring COVID into the lodge.
Yeah.
So we really have to be careful.
Yeah.
So
this is a little, Trish is painting a good picture of kind of the complexity
Yeah.
of doing this work during the COVID time
Yeah.
and the changing things might open up, then things might close down. We've seen that in other states,
Yeah.
and so
yeah.
so it's an ever changing kind of
Yeah.
target.
And of course, in an emergency, we have no choice of going in. So
Yeah.
we never know what we're walking into. So, you know, obviously, if somebody pulls their pull cord, we have to respond. Sometimes if we do call and say, you know, what's going on, if they say, oh, I'm having back pain, you know, we can kind of screen that out to see if we really have to respond to that. Fall, yes, we have to respond to. You know, cardiac issue, yes, we have to respond to. There's no doubt about that. Respiratory, we will not. We will either send them immediately out, or we will tell them they have to call their PCP. But I would probably err on calling Concord Fire for respiratory and send them out, but not risk ourselves going.
Yep.
Yeah,
Yeah.
because the risk of spreading that, not knowing what it is, we don't have the resources. I mean,
Right.
I have a staff of six staff members to oversee 450 residents. So if one of us goes down, that's our department pretty much.
Sure.
So
Sure.
Yeah.
Great. Well, thanks, Trish.
you're welcome.
I just want you, CP interns, to know that Trish is a great resource for you. She's at the middle of Beach Court?
Yep.
Beach Court,
Yep.
off of Main Street, so
Yep,
thanks so much
anytime.
for being with us.
You're welcome.
Thanks. I'll just introduce you. So I'm with John Leahy, who's the Director of Information Technology.
Well, actually, I have two titles.
Okay.
I'm the Director of Information Technology, and I'm the Chief Information Officer. So I have a department of two, myself and Jesse Dorling. We support staff and residents in IT related issues or requests. We are located in the basement, and I think you might have seen Michelle down in the basement of the HSC in some of the prior videos. But the IT department is physically located there, plus our phone numbers are 229-1201 and 229-1170. We, just as a little fair warning, when it comes to email, as you're assigned your Havenwood Heritage Heights email address, we do conduct simulated spear phishing attacks. So that is to just make sure staff is on the ball with identifying potential threats, cyber threats coming from outside via email, which we all know scams and everything else is going on out there. So this is just to help reaffirm that. I just put that out there. Our emails will have a label in the top for inbound email from the outside warning you not to open the emails if you aren't expecting the email or it's not a trusted site. So there's going to be a big yellow warning, and that's what that's about. Whenever you have inbound email come to the company here during your class that you might be reading. So I just point those two things out. You will learn more about acceptable use policy as you do your orientation. Computers are all covered in that section. So I wish you a happy class here with Michelle, and if you need anything from IT, feel free to give us a call.
Good morning, everybody. This is Scott Danico. He is the Director of Support Services, and I just want you to recognize his face, and there's lots of people who work for him, so I'll let him tell you a little bit about what he does.
Thanks, Michelle. First of all, what is support services? Support services is some of the hotel services I look at them at. It includes housekeeping, laundry, security, and dining services. Dining services being the biggest service. Within each of those services, there's different tasks that we have. For example, in housekeeping, we do all the linens and towels for our health service center residents. That's our skilled nursing facility. But also they go and do to the independent community, they do maid services, and they also do laundry services for them. Our laundry services is they drop it, we pick it up in the morning, we drop it back off later on that day, all clean and folded. Our maid services is scheduled, and we take care of those as needed throughout both the campuses, and that's done on a fee basis, and the laundry is actually done on a fee basis also. In security is overnight security. Security includes a 7 p.m. to 7 a.m. shift. What we do during the security is we do rounds of both campuses, but more importantly, the main responsibility of the security guard is to be the first responder if our emergency response system goes off. Our emergency response system being the pendant or pull stations that are located in each resident's apartment or room that they pull and that we will respond to. In dining services, we have multiple dining venues. Our dining venues on the Havenwood campus include the Four Seasons Dining Room. Typically pre-COVID-19, we would take those residents that are in our lodge. They come 3 meals a day into the main dining room, which we call the Four Seasons Dining Room. We also have on this campus Main Street Cafe. If those same lodge residents prefer to eat in the cafe, they're welcome to. But our Main Street Cafe also services all of our staff. Staff are welcome to come down there for their meals. On the other campus, we have the Barrows Dining Room. Recently renovated, it's probably 3 years old now, recently renovated area that basically services all the independent residents on the Heritage Heights campus, but any resident, whether they're on this campus or that campus, can go there. We also feed staff in that same dining room. Also in dining, we have a very large catering program, something that Michelle and I have worked on many times to do different catering events for the pastoral care department. But we do catering events for all departments. We also do catering events for companies coming from the outside. So pretty much you can see every department is unique, but every department has great people overseeing the different responsibilities. I'm very fortunate. I've been here 16 years. A lot of my supervisory staff in each of these departments have even been here longer. So when I look at the longevity of all my people, how well they're in tune to the residents here, it's a great feeling. Know that all my departments are covered with great people. So if there's any reason you need to get in touch with me for any of those departments, feel free to. Best way to get in touch with me is by extension 1171 or via email. Thanks, Michelle, for allowing me this opportunity to introduce myself.
You're so welcome. I've been asking everybody, Scott, how COVID-19 has been affecting your kind of disciplines. And I'm sure between the housekeeping and dining, I know it's been very much impacted.
Yeah.
I don't know if you could say a little bit about that.
Sure. But when I mentioned all the different tasks that we have within every different department, every single aspect of what we've done, especially in dining services, has been affected by COVID-19. I mentioned the lodge residents coming to the Four Seasons dining room for their meals. That is no longer allowed. So what we are doing is we had to change our whole program to now do a on all disposable meal delivery to each of their rooms in the lodge area. So we do that 3 times a day. So that's been greatly affected. The cafeteria of Main Street Cafe is no longer open to residents. It's only open to staff. And that is all on a to-go basis. Nobody's allowed to eat in the cafeteria where we serve, so everybody's got to take it out. By the graciousness of Mike Palmieri and the administration here, because they know how hard the employees have been working, we have been going since mid-March with all of the staff being able to get free meals in Main Street Cafe. And that's free meals for all 3 shifts. So that's greatly impacted how we do business, how we package food, how we present food. At the other campus in regards to dining, the Barrow Center, we are all on a delivery system. We develop a menu, and we have the residents call in, and then we deliver it to them the next day. Throughout this process, we've had a set menu, and we've altered it or had different editions of it 4 times, just to keep things fresh, to keep things new. But right now, we're packaging it all up in a simple to go. We offer reheatable meals that they can be heated up in the microwave, or we offer sandwiches, salads. We also have what we call essentials. There's those items that the people like to keep on their shelves, but they can't get to the store for. Things like milk, bread, even snacks. We have those on our menu too, so they can order some essentials from us, and we would deliver them to them the next day. In regards to housekeeping, basically, we just have to be a little bit more cautious of COVID-19 and some of the precautions that we're taking when we go into residents' areas to clean their rooms. One of the biggest things we've seen is maintaining social distancing. You got to remember, these residents haven't had a lot of visits, so then we go there, they're always willing to talk and everything. We need them to go into another room while we clean one room, and then we switch out the rooms so we can end up cleaning their entire apartment. But because of this, it's a little awkward sometimes, because these residents have become part of our family and our family members. When we're constantly going in, seeing the same residents and cleaning their apartments, they look forward to that social interaction. So it's a little bit tough on us to make sure that we're maintaining that social distancing, that we're wearing masks. We've always had strict standards on the proper sanitation and how we clean, so that's still being maintained. But it really hasn't affected us a lot regarding the process of cleaning their apartments. Their laundry, we're doing the same way. It's touch-free. We pick it up and we drop it off. We don't see them. We don't interact with them. And that's a good point to mention. I mentioned the delivery of meals that they call up and we deliver the next day. That's also touch-free. We're not allowed to greet the residents. We set the food on their doorknob, in a bag on their doorknob. We ring the bell and we go. So we try to reduce the interaction with the residents. Just one of those things that we can do to stop the spread of the virus.
Yeah.
Security is really no different. We still maintain that we have to respond to the emergency response system. Emergency response system is checked by security 3 times a night to make sure it's effective and working. And then we basically have to report and go to each situation. The only really difference now is we are masked up. We were always gloved, but we are masked up now. That's probably the big difference with security.
Yeah.
So you can see every aspect of the operation has been affected by COVID-19, but we've managed. And the next phase is obviously how do we start to slowly move back to what we were doing before and what sort of steps we take. We're definitely looking at the CDC for all their recommendations on how to do that. And this is something that I think that we will slowly do. We haven't yet began that transition in dining.
Yeah. Marvelous. Well, thank you for your time, Scott. I really appreciate it.
All right.
And all these folks have open door policies, so if you have questions and that, you know, you can reach out to any one of
Yeah.
these folks.
Like I said, email is a great way to do it. I
Yeah.
also have, my telephone is 229-1171, and my office is located just inside the kitchen. You're always welcome to come visit me.
Great. Hi, I'm here with Suzanne Weaver, who's our Health Service Center Administrator. And I just wanted to spend a few minutes letting her tell you a little bit about what she does. And her role is really watching out for everything that happens in our nursing facility. But I'll let you, Suzanne, tell the students a little bit about yourself and about your role here.
Thank you, Michelle. So my role, I think, is pretty exciting. Each and every day I come into work and I check on the quality issues for the residents, the care. I want to make sure that every day, every resident is being treated like I treat my own mother. So I check in with the staff, I read reports, I go talk to the residents, I hear, concerns that they might have, maybe about their hot water not working, or maybe they want to do more activities and programs. So I'm kind of the person that connects all the dots. I try to make sure that they are feeling like they have quality in their lives, that they're getting the most out of each and every day, that the staff are treating them nicely, appropriately, kindly, that they are engaging the residents and making sure that they're treating them as individuals. That's really important to us. This is their home, and my job is to make sure that their home is a nice place for them to live. So I spend a lot of time getting to know each resident and each staff member. So I think that's so important to know people by name, because then they feel like they're important, they're a person, they're not just a room number or a name. I think that's so important to all the work that all of us do, is the relationships that we have with the residents and the staff. That's why it feels like a family, because this is their home and we are their family. I'm trying to think. A couple other things about me I think are pretty interesting is that I'm coming on up to almost 10 years at Havenwood this coming March. I'm a social worker who was a nursing home administrator, so that's not the norm actually. So I was fortunate enough to be a care manager here, that's what we call social workers, and then I was the director of a department, and I went through an AIT program here. It's called Administrator in Training. So I've grown in my career here at Havenwood, so that allows me to know all those residents and all their families. So I'm very invested in the outcomes in their care, probably more so than most because of that, just because they are people that I know. I also am part of the professional advisory group, so I will be joining some of your Zoom meetings, and I hope to be an asset and helpful to you as you go through your learning process and opportunity. And if you ever need any questions answered or concerns, please reach out to me anytime. Michelle can help you, or else you'll have my contact information. Thank you and good luck.
Thanks, Suzanne. I was asking everybody else kind of how your role has changed because of the pandemic, and I know it's probably affected you more than anyone. And I know that we'll have the students kind of assigned just to one area in the health service center, and just wanted you to, but what else is?
So my role, my life has changed dramatically, as has the lives of the residents and the staff. So there are a lot of changes that happened. When COVID first came about, we locked the place down, basically. We couldn't let anybody in. Our residents' lives have been very restricted, so I implement all those changes, right? So I have to call all these families, tell the residents. That's very hard, because they mean so much to them. So I'm the person that hears the rules that the CMS, which is the Center for Medicare, tells us we have to adhere to, and I'm the one that implements all the rules. Those rules change a lot. They can change week to week, day to day. So whether it be on a Saturday at, it seems like a lot of them happen Friday at midnight, my job is then to implement them and roll them out through the whole nursing home and the levels of care there. So, it goes from when they can't eat meals together, the residents, they can't go into appointments, or they can go into appointments, but they have to quarantine. It's knowing all those nuances of everyday questions that seem pretty normal to all of us that aren't normal anymore. Like, can they go to the hairdresser? Well, they can't go to the hairdresser. What if they have to go to the ER? Do they get quarantined or not quarantined? We had to build a little isolation or admitted unit. We had to prepare that if we got COVID, what do we do? So it's always just going with the flow and being prepared to jump on whatever change is initiated, and then supporting the team and the residents and rolling out those changes. So it's ever changing. I'm working on a new change today. I was just in the dining room trying to think about the possibility of indoor visits limited. And you know what? In 14 days, they talked about that could change again. And if we get COVID, it changes again. So there are all sorts of factors that go into everything that I do. And I need a team that supports me. They help me roll those changes out, but it's have to always be in flux and willing to be flexible.
Sure. Great. Thank you so much, Suzanne, and I know that the students will interact with you plenty when they get here, so thanks so much for your time.
Welcome aboard. Thanks.
Hi, folks. Sitting here with Tabitha Dowd, who is our Director of Nursing. She's been here 5 weeks? 6 weeks?
About 49 days.
49 days. Well, welcome again, and she's going to tell you a little bit about her role here. She oversees the nurses in the Health Service Center, but I'll let her tell you a little bit about her vision for her department, and also if you could tell the interns how you might see them working collaboratively with your folks, that would be very helpful.
So again, yes, my name is Tabitha Dowd. I am the Director of Nursing here at Havenwood Heritage Heights. And I see my role really as being the resource for the clinical team to ensure that they have the tools and expertise to provide excellent care that our residents expect. I anticipate that we would work collaboratively with you as a team to meet the residents' emotional and spiritual needs. I really feel that there is a strong need under the current conditions of COVID and continued isolation for these residents, that we partner as a team and think of alternative strategies to be able to enhance their well-being and sense of independence while they're here. That's kind of me in a nutshell.
Great. Could you just say a little bit about who, like the who works with you on the nursing staff?
So we have 3 units. On each unit there is a unit manager. There is also a charge nurse. We usually have an MNA, which is a medication nursing assistant, licensed nurses assistants for personal care, and we also have some personal care assistants who help with some more of the social interaction. In addition to the nursing clinical team, we also have lots of collaboration with our therapy department as well as our activity program. So we really look to have an all-inclusive, interdisciplinary team to focus holistically on our residents here at Havenwood.
Great. Excellent. Well, and once you get your assignments, this is Michelle speaking, once you get your assignments, you'll be able to more closely introduce yourself to the nursing staff that's on your units while you're here midweek, and that'll be an easy way to get to know folks. So, I hope it's okay, Tabitha, that if they have particular questions for nursing.
My door is always open. Please stop down and see me.
Okay, marvelous. Well, thank you, and I appreciate it.
Well, thank
So I'm here to introduce you to Eliza Lebrecq, who is the Director of Care Management here. She's going to tell you a little bit about what her department does and what her role is here.
Hi everyone, welcome to Havenwood Heritage Heights. We're excited to have you here. Just to tell you a little bit about the Care Management Department, we currently have 3 social workers, including myself. We have Sue Close and Abigail Kelly. Right now we're all kind of helping fill roles, but we cover all spectrums of the Havenwood continuum. We cover Heritage Heights, independent living on the Havenwood campus, as well as assisted living and within the nursing building. In general, we really meet residents before they move into Havenwood, starting with their application interviews, and have a high focus on building relationships with them and their families throughout their continuum and stay here with us. Can we have a pause? So we really help residents and their families through a wide variety of situations and topics. If residents are independent and are needing some more help at home, we help connect them with services in the community to help keep them independent as long as possible. If people are getting to a point where they need a transition to a higher level of care, we work with the residents and their families through those conversations and facilitating the move into the appropriate place for them. For admissions into the community, we work with the nursing staff as a team to interview residents prior to their admission. So we are involved in all admissions to the community, but if there's admissions to levels of care, we also help with that application process and coordinate with the hospital if we do have residents who are in the hospital, if they're going to need to come back to our health services center for some extra care before going home. We help coordinate discharges from the health services center back out into the independent living sections of the community. We help with end-of-life conversations, connect residents and families with hospice agencies. What else do? We kind of coordinate the care conferences in the health services center. We will send out the letters to families, and there will be invitations invitations that go to the families, and staff get a list of when those are. So if you have residents you're working with and you see their care conferences coming up, you can connect with us about if you're feeling like you'd like to attend those. We help with arrange swell chats. That's a great tool that we use to stay in touch with the independent residents, since we don't really see them as much on a day-to-day basis, and a lot of them are just off living their own lives. It's how we all stay connected with them.
Eliza, can you talk to them a little bit about some of the things that you have been coordinating to keep residents connected to their families? Thinking like the virtual visits and the outside visits.
Yep. So it's been really hard for residents with all the COVID-19 restrictions that we've had to be shut off to visitors since early March. So that's a huge change for a lot of our residents and their families who are here daily visiting. So what we have been doing is we did set up a virtual visit calendar for the Health Services Center. There's a calendar for each floor. Every resident can have a visit scheduled twice a week where they can call their families over FaceTime or Skype or Zoom. And we've really had to just get a lot of volunteers. It's been all hands on deck trying to support the residents and their families being able to see each other, but that's been really important for them, for that socialization piece and staying connected to their families while they unfortunately can't come in. A couple months ago, we were able to increase that a little bit to do some outdoor visiting. So residents can go outside, families do have to stay in their car. They're separated by plexiglass, but it gives them the opportunity to visit with their families for a limited time frame, a little bit more in person instead of over the screen.
Great. And how do you feel COVID-19 has affected kind of your work on the floors and in the independent community?
Yeah.
Has it?
I think it has been a challenge in both aspects, and it's changed things in different ways. In the independent community, we've kind of been asked not to be out with the independent residents as much, especially if they are in the cottages. We also don't completely know what they're doing. Although we ask them to stay on campus, they could be out and about more than we know about. So we're just trying to limit exposure and limit people going out to visit with the independent residents. So we've been doing a lot more over the phone with them than we had in the past. We normally might just go meet with a resident in their cottage to chat about something, but now we're trying to do alternative methods. In the Health Services Center, I think that we've seen the residents rely a lot more on visiting with staff because they really want to have that in-person connection, and since they can't get it with their families, I think that the staff and the residents have gotten closer just because that's what your connection is that they're missing from their families.
Sure. Can you tell us just a little bit about your staff and how their assignments are
Yeah.
right now?
Yep.
And this may change in September, so we'll have to get an update.
Yes.
But-
So right now is a little bit different because we do normally have 4 social workers, so we're usually more organized in our coverage. But so right now we have the 3, myself, Sue Close, and Abigail Kelly. So myself, I'm the director of the department, but also cover independent living on the Havenwood campus and lodge assisted living. Sue Close covers Heritage Heights. And right now she's covering the Rainy unit, which is not normally what she covers, but is what she's helping to cover from our open position. Sue and I are both sharing covering the first floor in the Health Services Center. Again, what the open position would cover, but we're kind of sharing those duties right now. And Abigail Kelly covers the 3rd floor and Melody Lane, and she also does admissions into the Health Services Center.
Great. This will all make better sense for you once you get here, but I wanted you to at least hear the names, and you can always go back to this video as well. And all this material will be in the handbook as well. Well, thank you, Eliza, for
Thank
a
you.
great introduction, and the students will get to meet you in person soon.
Sounds great. Thanks, everyone.
Hi, everyone. I'm downstairs in the the therapies suite here with Amy Zerpolo, who's the director of rehab. She's going to tell you a little bit about what her group does. And so I'll turn it over to Amy.
Okay. As she said, my name is Amy Zerpolo. I am the Director of Rehab here at Havenwood Heritage Heights. I have been here since August 2004. I am a physical therapist by training, but here in the rehab department, we offer occupational therapy, physical therapy, and speech-language pathology services, just to our residents. So we deal with a lot of Medicare here. An occupational therapist helps, usually they focus on someone's activities of daily living. It can be as basic as your bathing and dressing, ability to eat, ability to cook, or some of the other things, manage your finances, your appointments and whatnot. They do functional cognitive assessments, which is not an IQ test, and it's not a test for dementia, but it tests in a day-to-day setting with basic things you do. How does your brain work and at what level, and what your strengths are, what your weaknesses are, and can we use your strengths to help overcome any areas that you have challenge in. A physical therapist, people are probably a little more familiar with. We help people with, general aches, pains, injuries, balance issues, vestibular issues, pelvic floor issues. I think most people have heard about a physical therapist before, I will say that. When I first started, people didn't. They thought we were all massage therapists, but I think nowadays people have a pretty good idea. Speech language pathologists basically kind of are like from the neck up. So it can be your ability to chew and swallow, it can be your ability to think, it can be a little bit of how your brain functions. They do some of the brain stuff, but because it's a little different than what OT does, I would say on a case-by-case basis we could talk about it and what might be better for someone. Often here, here in the therapy department, historically we have offered both short-term rehab and what we call our health service center, which is our a nursing home level of care, and we also offered outpatient therapy services. However, with the pandemic, we had stopped all face-to-face outpatient therapy, and we are just slowly starting telehealth therapy, although it is a little more challenging for our residents. We are working on a license that will allow us to see people outside this building, but we're just not quite there yet. I will say that when I think of the CPE interns, I think of a resource for us. Here in the therapy department, we hear a lot about people's problems, their challenges, their thoughts. Because we spend a lot of one-on-one time with them, we hear a lot of things that they may not share with other people, and we identify things that they may be struggling with that they either do or don't understand. So we a lot of times will pick up the phone and we call the spiritual care department to say, hey, here's what's going on. And sometimes we'll say, the person's okay to speak with someone. Can you maybe just swing by to say, checking in, see what happens? We definitely lean on you guys a lot. So please feel free at any point in time to come talk with us, to say, to just talk as an interdisciplinary team member about what's going on with someone, how we can help, how you can help, how we can help each other. Is there something you've heard, a way that we can maybe do something better with what you've learned, with what you've discussed with them? We are definitely very open to that, and we appreciate all of your input.
Great. Thanks so much, Amy. So I'm sitting with June Burby, and her title is the MDS Coordinator, right?
Yes.
And I'm going to let her tell you a little bit about what that is. She's been here probably as long as I have been, and has been really a solid supportive part of the staff here in the Health Service Center. But I want you to know her unique role, and which is, I think, an important one here. She kind of oversees, but I'm going to let her explain what she does.
Hi, I'm June, and I'm technically the MDS coordinator. What that means is that I do the assessments for the residents to determine their appropriateness for being in the bed. I do it for Medicare and Medicaid. We also do it in order to identify those problems that need to be care planned so that we can provide the best care possible for the residents while they're here. I do look at all of the documentation that's done. So your notes to me are very important, because very often there'll be something in there that will trigger something in a care plan. And I'm here Monday through Friday. And if you need me, I'm on the first floor through the black door. Take a right, and my office is right by the sliders.
Great.
So I'm here.
June, can you explain, because I always get this mixed up, and so if they can hear it from your mouth, what the difference between Medicare and Medicaid, generally speaking, like how that works to support the residents?
Medicare is a federal program. It is used for the folks that come out of the hospital. They have a limited period of time where Medicare, the government, will pay for their care while they're here, while they're recovering. Medicaid is a state benefit. It is used for when folks basically run out of money. And the state then compensates us to some degree and helps pay for their continued stay here in the nursing home. Because we're a continuum, we do not ask that anyone leave here, this community, because of financial reasons. We will take them on Medicaid and accept the Medicaid payment that comes.
Great. And can you talk a little bit about when somebody goes to a hospital, there's a minimum of 3-day stay in order to get Medicare, right?
Care, yes. Yes. The technical requirement is a 3-night inpatient stay, not observation, but inpatient. And they have to have a qualifying diagnosis. They have to have a legitimate reason for being there. Weakness, some of those things are not a good reason. Breaking a hip is.
Right.
So there are certain diagnoses that you have to have. And at that point in time, the federal government offers up to 100 days of care that they will pay for. In order to do that, you have to show progress, and you have to be continually working for that goal of returning to your prior level of care.
Great. So June is always part of the Monday morning interdisciplinary team that the chaplains sit in on, and if there's opportunities for you to come in on a Monday, you could do that. But you can hear June's listening to the conversation with a little bit of a different lens than some of us, because she's paying attention to are we in good stead with
Are
the
we
regs?
in compliance? Yeah.
Yep, compliance, right. Okay, any last word to the interns, June?
More than welcome to visit anytime.
Great. You can see the cafe is here. The front door is here. And I'm at the top of a set of stairs that I'm gonna go down now into the basement. It's another part of the basement. There are more bathrooms here, right under the other bathrooms. Yeah, I'll go down this way. This is where folks get their hair cut at the end of the corridor there. And in this little corner is where finances, we have, let's see, 6 people in our finance, and you can kind of come down here and meet them if you would like. In front of me is human resources, and here is Lisa Graham, the pastoral care, the spiritual care department's office, and this is Lisa.
Hi.
Lisa, can you take off your, I'm just doing an interview, kind of a little video for the new interns, so.
Oh, great.
So Lisa is kind of our hub and she's kind of the glue that keeps us on task, and very helpful for the interns when you need some help. What you doing today, Lisa?
Right now I'm working on news and previews.
Yep, so news and previews comes out every week, and Lisa always oversees what goes into news and previews for our particular department. And Lisa's also the person who puts up death notices and arranges for us around memorial services and does a lot of background support for us. So anything else? Tell them a little bit about yourself, Lisa.
Well, I work here part-time, Monday through Friday, usually 9 to 1. I live in Hopkinton, New Hampshire. I have twins, boy-girl twins, who are 17 years old, so they keep me hopping and very busy and stressful. But I have been here working here 7 years, 8 years now, and absolutely love it, and I look forward to working with you all.
Great. Thanks, Lisa.
Thank you.
And when you get here, there'll be folders here that'll be right here, that will be almost your mail slots. The staff, you can see we have calendars that tell you kind of what's going on for the department, and our mailboxes and mine and the chaplains are here. And then when we go in to the CPE room here, I'm gonna stop here.